Before we talk about what diseases asbestos exposure can cause, it's helpful to look at the anatomy of the what's called the pleural cavity, in other words, the chest cavity. So the inside of the chest cavity is lined by a very thin, glistening, shining membrane, which we call the parietal pleura. And similarly, on the surface of the lung is another membrane, which is called the visceral pleura. This diagram shows a space between these two, which is not normally present. Usually there's just a very fine film of fluid between these two surfaces. The red line here represents the endothoracic fascia, which is just a thin layer of tissue underneath the pleura. Here we can see the diaphragmatic muscle, and on the undersurface of it, peritoneum, which is also a thin layer of tissue lining the abdominal cavity. When we come to talk about the operation of extrapleural pneumonectomy, it's important to realize that although this pleura that lines the inside of the chest wall can be very readily stripped from it by blunt dissection, doesn't require any instruments. The same is not true over the diaphragm and indeed the pericardium, which lines the cavity where the heart is. The only way of removing the pleura there is to remove the diaphragmatic muscle itself, and in the case of the pericardium, the pericardium. So I think that sets the scene for one of the later slides, which shows the diseases that asbestos can cause.